Of all the diagnoses in mental health, the one most feared by patients is schizophrenia, because it often carries a stigma of hearing voices and violent behavior. According to a series of reports in the United Kingdom, it's also the one that psychiatrists often use for Black patients of Caribbean background. Such a diagnosis often carries high doses of antipsychotic medication, which can have terrible side effects. In the second part of our special report on mental health, Henry Bonsu explores how this trend has impacted British Jamaican Gary Elson and how Caribbean nationals are doing their part to improve the lives of their own people. Let's head back to London, 52 degrees north and 0.5 degrees west.
Despite years of knowing that Black people in the UK and Western Europe are far more likely to become mentally ill than their counterparts in Africa or the Caribbean, there's still no real consensus why. Some specialists say it's because of something in our genes. Others say we've been taking too many drugs. Then we have unemployment, racism, thwarted ambition. Is the system institutionally racist?
Historically, psychiatry is a racist discipline in the sense that it starts from the premise that Black people have the mental age of children, white children.
It's often said that white patients get given talking therapies, Black patients get given liquid therapies, the hardcore tranquilizers. Is that the case? Is that really true?
If you look at the number of people on section as a proxy of the acuity, severity of illness, then clearly there are more patients who are African Caribbean who are on restrictive section like section 3 than local white population. There's no doubt about that. And if you are on section 3 as an inpatient, the following are likely to happen. One, you're likely to be given medication predominantly. And we're talking of medication that has significant effect in you. Two, the kind of medication you're likely to be giving is likely to be depot medication or injection to calm you down.
When I first entered the system 30 years ago, I was on a drug called haloperidol. And that was a killer because you used to get side effects like locked jaw, top jaw going one way, bottom jaw going the other way, and it was very painful. You get stiffness of the bones. You get your eyes going up, and you get blurred vision. And those are just some of the side effects that you used to get.
How many other people did you see on this particular drug, and what kind of people were they?
Mostly Black people were on, when I first went in, were on haloperidol.
And how does that compare to the drugs that white patients were on?
White people were on different things, but most of the Black people were actually on haloperidol.
Black Mental Health UK are very concerned because this is where the UK's African Caribbean communities are being warehoused. We see this as violation of human rights, and unless these human rights violations are addressed, i.e. the use of restraint, unnecessarily high doses of medication, the fact that this group are never offered anything other than the medical model has to be addressed.
Over the years, the National Health Service in this country has introduced a whole variety of programs, like delivering racial equality, the annual Count Me In census, but they've had precious little impact. So what will? Some say the answer lies with us.
Well, the Dragon Cafe is a place where I go on Monday, and they cater for mentally ill people, and they provide healthy meals. They show films about mental conditions. They do poetry, and they just do things to help people, feel good about themselves.
What is your hurry? Why such a haste? Such a full diary, no time to waste. Slow down a little, slow down.
They make drugs that go in the bloodstream and affect the body in a particular way, but this poetry, this sharing together and this communion goes beyond the body and goes into the soul and the mind and the heart, and that's what people really need.
I'll get medicated once a month and I'm on 200 milligrams of Clopixel.
And how does that make you feel?
First couple of weeks I'm a bit drowsy, and as it begins to wear off, I get more lively, you know.
Because I've seen people, when they're drugged up, are not able to participate because they fall asleep and they're dribbling and they're slobbering and they're nothing. They become almost like a ghost. And I once, on one occasion, asked, please don't give the drug before my poetry workshop. And then the very guy who I noticed, a big black male, he was able to participate.
Do you resent being on that drug, or do you think it's actually making me better in the long term? Or what are you thinking?
Well, I think the drugs are there to help make you better, so you might as well just take it until they reduce it, or ask for a reduction if I think it's too much for me.
If you have a child in this country and you happen to be fortunate enough to have the relational connections back in the West Indies, or you have the sort of influence and the people you know there, and you can take your child back to the West Indies and leave them there for a bit to absorb some of that culture, then it would be the equivalent of the best medication you could find.
Well, we know what the experts and the analysts think, but what about the regular people of Brixton? Why do you think that so many of us are having problems with mental health?
Because we're hiding it. A lot of people have issues and they're too proud.
To be honest, I'm not sure how it can be rectified, other than obviously people speaking about it and making it more open.
We need a new card. That racism card is outdated. We have to think within ourselves and try to help our community. We're too selfish.
And what about your identity? How do you see yourself, as a man, as a black man, as a Caribbean man? Do you ever think about that?
I do think about it, and living over here in this system, a lot of us are misunderstood, and I'm just one of the unlucky ones that got caught up in it.
It's been hard, but thank God, that he's come a long, long way. And I was saying to one of my members at work, you know what, I'm really proud of him, because since Mummy and Daddy has died, you've kept yourself together, Gary, and you've accomplished a lot on your own. And honestly, I'm really, really, really proud of you.
Do you think about having a partner, and family, etc.?
Well, I don't think so much about family, but I wouldn't mind if I had a family of my own. But I do think about a partner sometimes, but I've got many friends, but none of them are suitable.
Do you ever think, why me? Why am I living with this condition? Why do I have to be on drugs? Why am I living like this? Or do you think, well, this is life?
Well, I think it happens to some people, and it happened to me. Yeah. And I've got to live with it. That's what I think.
We asked the UK Health Ministry for a response to our story. Mental Health Minister Norman Lamb said in a statement, "There are complex reasons for the high numbers of people from different ethnic backgrounds in mental health services. I take these issues very seriously, but this isn't a job for government alone. We need community leaders, faith groups, and individuals to play their part." Coming up on 18 Degrees North, is returning home to the Caribbean the best remedy for UK mental health patients? We asked Dr. Frederick Hickling of the University of the West Indies, Professor of Psychiatry.
When we go to Britain and get sick, they really do want to lock us up.
That's next on 18 Degrees North.
The preceding segment was brought to you by
JN International Money Transfer.